What is up, everybody? Ooh, one serious video to another. It's different. Yeah, I'm doing a lot of serious videos in my recording session today, so just fair warning to anybody watching these. But, hi. So, let's talk about a private struggle that I've been having. And, I want to keep this one a little bit lighthearted, I guess, because, well, obviously I'm not making light of what I've been dealing with. But, I feel like my last video was a little too heavy-handed, a little too serious. So, let's kind of make it a little bit lighter, I guess. At least try to. I probably will fail. Anyway. So, I've been dealing with something that I don't talk about very often because it's embarrassing. I feel weird talking about this disorder. It's not really a disorder anyway, I don't think anyway. Maybe it is. I haven't really looked into it. But, you may have noticed in my previous videos I had a scab right here. Like, right next to my eye. I still kind of have a sore spot there, actually. What that was from was actually an ingrown hair. Now, the reason I say that is because usually it's very hard to get one around this area. At least as far as I know. Maybe I'm wrong. But I don't usually get them in that area. Usually it's on my hairline, because my hair is kind of long. But, you know, that TMI aside, I've been dealing with something called trichotillomania. For those who don't really know what trichotillomania is, I'm going to explain it to you. Okay. Trichotillomania, also called hair pulling disorder, is a mental disorder that involves recurrent, irresistible urges to pull out hair from your scalp, eyebrows, or other areas of your body despite trying to stop. Hair pulling from the scalp often leaves patchy bald spots, which causes significant stress and can interfere with social or work functioning. People with trichotillomania may go to great lengths to disguise the loss of hair. For some people, trichotillomania may be mild and generally manageable. For others, the compulsive urge to pull hair is overwhelming. Some treatment options have helped many people reduce their hair pulling or stop entirely. So essentially, I have actually been pulling my own hair. It hasn't been up here, because for some reason I just don't like the idea of pulling this, but it could escalate to that very quickly if I'm not careful, which is what I'm afraid of. You know, and at least I believe it can escalate. I'm going to read more of this in a second, but the areas that I've been pulling hair from were my face, this area, my eyebrows, like in between my eyebrows, right here, and my arms. And sometimes I don't even realize I'm doing it. Sometimes I'll be watching a YouTube video and suddenly I'll just start going. And I'll start plucking. And sometimes I'll start plucking here, or I'll start picking at my arms. And I started realizing what I do to my arms earlier while I was watching wrestling. I was sitting there, and I was a little frustrated with what I was watching. That's not really important, but it's just a fact of the matter. And I decided to get on my phone, you know, just to see what was going on with Discord or whatever. And I started plucking at the hair on my arms and pulling them out. And that wasn't just like pulling out the hairs, I was pulling out the root with them as well, which is not good. Pulling out the root can cause some serious problems. And, you know, it took me a bit to realize I was even doing it. That's scary when you think about it, because you look down and you suddenly realize that you're playing with your own hair. But, let's talk a little bit more about it before I talk more about my issues. Symptoms. Repeated pulling your hair out, typically from your scalp, eyebrows, or eyelashes, but sometimes other body areas and sites may vary over time, i.e. my arms. Increasing sense of tension before pulling or when you try to resist pulling. That's constant. A sense of pleasure or relief after the hair is pulled, especially for me around this area. Noticeable hair loss, such as shortened hair or thinned or bald areas on the scalp or other areas of the body, including sparse or missing eyelashes or eyebrows. Now, this is actually interesting, because I started realizing on certain parts of my body that there were little patches where there was no hair. And I thought, like, oh, maybe it's just growing weird or something. I didn't realize I was actually plucking them. without thinking. And I don't know if I could really find any areas on my arm right now that are like visible, but I have been doing that a lot more, and it's rough to really think about, like, hey, this is something that you've been doing, and I am extremely embarrassed to talk about this. Biting, chewing, or even eating pulled out hair, I think that's one that I don't do. Playing with pulled hair, rubbing it across your lips or face, I've done this. I'm embarrassed to admit that I've done this, but I've actually toyed around with the hairs after I plucked them. I would look at them, and I would go like this, and I would just kind of mess them a little bit. And sometimes I actually would, like to see how they feel. It was really odd to me that I do that. You're really trying to stop pulling out your hair or trying to do it less off without success. Yes, constantly. Significant distress or problems at work, school, or in social situations related to pulling out your hair. I don't think I've ever done this in public before. I might have, actually, without even thinking about it. If I did, oh my god. Many people who have trichotillomania also pick at their skin, bite their nails, or chew their lips. I do those. I'm constantly tearing the skin off my lips. And I actually do bite my nails. That's something that I'm not exactly happy to admit that I do, but it happens. Sometimes pulling hair from pets or dolls, or from materials such as clothing or blankets, may be a sign. Considering my dog sheds a lot, and I do kind of pluck the loose hair off of him, and I have actually pulled hair from materials like blankets and stuff. So, yeah, never really with toys, though, as far as I'm aware. Most people with this disorder, with trichotillomania, pull hair in private and generally try to hide the disorder from others. For people with trichotillomania, hair pulling can be focused, in which some people pull their hair intentionally to relieve tension or distress. For example, pulling hair out to get relief from the overwhelming urge to do it. Some people may even develop elaborate rituals for doing it, such as finding just the right hair and biting pulled hairs. And there's also automatic. Some people pull their hair without even realizing that they're doing it, such as when they're bored reading or watching TV. I think I'm somewhere in the middle. Because, or maybe I'm not. Have I ever actually done it purposely? I think I have done it purposely before in terms of my eyebrows, but for my arms it's more automatic. The same person may do both focused and automatic hair pulling. There you go. Depending on the situation and mood, certain positions or rituals may trigger hair pulling, such as resting your head on your hand or brushing your hair. Trichotillomania can be related to emotions. Negative emotions. For many people with trichotillomania, hair pulling is a way of dealing with negative or uncomfortable feelings, such as stress, anxiety, tension, boredom, loneliness, fatigue, or frustration. Now, I want to point one more out, gender dysphoria. That's actually another one, and we'll talk more about that in a second. And there's also positive feelings. People with trichotillomania often find that pulling out hair feels satisfying and provides a measure of relief. As a result, they continue to pull their hair to maintain their positive feelings. So, let's talk about gender dysphoria for a second. As a trans person, I do have this, and it is a bitch. Pardon my French, but it is a pain in the butt. The constant urge to, rip at my skin is maddening. I've actually attempted to pluck every individual hair on my face before. And right around this area is where it happens the most. Because, I'll be honest with you, I don't like my eyebrows. You can even kind of see, it's a little, it may look a little bit, a little patchy looking in certain areas. It's because I'm constantly, plucking at it. And I've actually pulled out, really stiff hairs that are bugging me, or ones that are stray or weird or whatever. That's more of the focused kind. But I also have the automatic stuff where I do this without thinking, like I mentioned earlier. Honestly, the dysphoria, I think, is the main reason that I do it. Also, anxiety and everything, and stress. I do this without thinking. Camera's a little out of focus. Sorry, I had to refocus my camera. But, yeah, this is not fun. Like, I am ashamed of myself. I shouldn't be, but I am. I'm embarrassed. But it feels a little good to get this off my chest. No one's pointed it out or anything. No one's been like, oh, your eyebrows look a little funny. Or like, oh, you're missing some hair in certain areas. No one's ever pointed that out to me. Mainly because I do it in a way that's not really noticeable. But I'm actually kind of afraid that this is gonna become a habit and I'm gonna start actually like tearing at my skin more. That right there is what I'm worried about. Continuing on. Trichotillomania is a long-term chronic disorder. Okay, so I was right to call it a disorder. Without treatment, symptoms can vary in severity over time, so it can escalate. Okay. For example, the hormonal changes of menstruation can worsen symptoms in women. For some people, if not treated, symptoms can come and go for weeks, months, or years at a time. Rarely, hair pulling ends within a few years of starting, not days. When to see a doctor. If you can't stop pulling out your hair, or you feel embarrassed or ashamed by your appearance as a result of your hair pulling, talk to your doctor, which I don't have. Trichotillomania is not just a bad habit, it's a mental health disorder, and is unlikely to get better without treatment. Add that onto the list, I guess. Causes. The cause of trichotillomania is unclear, but like many complex disorders, trichotillomania probably results from a combination of genetic and environmental factors. Risk factors. These factors tend to increase the risk of trichotillomania. Genetics may play a role in the development of this, and the disorder may occur in those who have a close relative with the disorder. I don't know if I do. Age. Trichotillomania usually develops just before or during the early teens, most often between the ages of 10 and 13, and is often a lifelong problem. I might be in like a different kind of case then, because I don't remember when I started doing this. I could be wrong, I might have done this a long time ago and just not remembered, because I don't remember most of my life, which sucks. Infants also can be prone to hair pulling, but this is usually mild and goes away on its own without treatment. Other disorders. People with trichotillomania may also have other disorders such as depression, anxiety, or OCD, obsessive compulsive disorder. Stress. Severely stressful situations or events may trigger trichotillomania in some people. Although far more women than men are treated with this, for trichotillomania, this may be because women are more likely to seek medical advice. In early childhood, boys and girls appear to be equally affected. Yeah, there goes that whole, like, men don't want to be seen as weak kind of deal. Like, that makes me worried. I worry about you dudes out there. Like, I do. Like, I'm not throwing shade or nothing. I worry about you. Nothing wrong getting help. Complications. Although it may not seem particularly serious, trichotillomania can have major negative impacts on your life. Complications may include emotional distress. Many people with trichotillomania report feeling shame, humiliation, and embarrassment. They may experience low self-esteem, depression, anxiety, and alcohol or street drug use because of their condition. I'm not at that point, and I will not get to that point. I'm staying away from alcohol and all that crap. Like, I have a good moral compass on that one, but I can see how someone would get that far. Problems with social and work functioning. Embarrassment because of hair loss may lead you to avoid social activities and job opportunities. People with trichotillomania may wear wigs, style their hair to disguise bald patches, or wear false eyelashes. Some people may avoid intimacy for fear their condition will be discovered. I want to talk about this for a second, because I actually watch a YouTuber who, I don't know if she still posts or not. She might have actually stopped for a while. But there was a YouTuber that I really like called Retana, who admittedly has, mental disorders. She has manic depressive disorder, and she's got trichotillomania and dermatillomania, which is, dermatillomania is picking at your skin. And, I looked at that and I'm like, I didn't understand it. I kind of get it a little bit more now. Like, I understood, why it happened and, why somebody would do that and they would feel bad about it. But when I read that most people wear wigs, I'm like, That sounds like Raytana. Who, if you guys don't know who she is, definitely check her out. She's got some really interesting content, especially if you like scary stories. Like, she does, like, creepypastas and stuff. A lot of them are My Little Pony related, though, so it might not be for you guys, but she also writes her own stories, which are amazing. And it's also where I got the term other, so definitely check her out. Skin and hair damage. Constant hair pulling can cause scarring and other damage, including infections to the skin on your scalp or a specific area where hair is pulled. It can permanently affect hair growth. In other words, it can stop growing, like completely. Hairballs. I don't think I have to worry about this too much, but it's worth mentioning. Eating your hair may lead to a large matted hairball or a trichobezoar in your digestive tract. Over a period of years, the hairball can cause weight loss, vomiting, intestinal obstruction, and even death. This is real serious, to be honest. Let's look at diagnosis and treatment really quickly. Diagnosis. An evaluation to determine if you have trichotillomania may include examining how much hair loss you have, asking questions discussing your hair loss with you, eliminating other possible causes of hair pulling or hair loss through testing determined by your doctor, identifying any physical or mental health problems that may be associated with hair pulling, using the diagnostic criteria in Diagnostic and Statistic Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. But honestly, like, it's actually noted by many people that you can pretty much tell when you have this because you'll be, plucking your hair. So, but it is good to get confirmation from a therapist. I'm not a licensed psychiatrist or anything, so I wouldn't be able to tell you if you do or not. But all I can tell you is what I know about myself. And I'm pretty sure this is something I've got. Because the constant pulling of hair without me realizing it, and then realizing that I've been plucking my own eyebrows and everything without, not being able to stop, it's been bugging me lately. Treatment. Research on treatment of trichotillomania is limited. However, some treatment options have helped many people reduce their hair pulling or stop entirely. Therapy. Types of therapy that may be helpful for trichotillomania include habit reversal training. This behavior therapy is the primary treatment for trichotillomania. Learn how to recognize situations where you're likely to pull your hair and how to substitute other behaviors instead. For example, you might clench your fist to help stop the urge, or redirect your hand from your hair to your ear. Other therapies may be used along with habit reversal training. Cognitive therapy. This therapy can help you identify and examine distorted beliefs you may have in relation to hair pulling. Acceptance and commitment therapy. This therapy can help you learn to accept your hair pulling urges without acting on them. Therapies that help with other mental health disorders often associated with trichotillomania, such as depression, anxiety, or substance abuse, can be an important part of your treatment. Medications. Although no medications are approved by the Food and Drug Administration, specifically for the treatment of trichotillomania, some medications may help control certain symptoms. For example, your doctor may recommend an antidepressant, such as, oh god, I'm gonna butcher this, sorry, clomipramine, or anafranil. Med names are weird, I'm sorry. Other medications that research suggestions may have some benefit include, oh god, are you serious? N-acetylcysteine? What? That is really hard to pronounce. I'm sorry. An amino acid that influences neurotransmitters related to mood, and olanzapine, Zyprexa, and a typical antipsychotic. Talk with your doctor about any medication that he or she suggests. The possible benefits of medication should always be balanced against possible side effects. Coping and support. Many people with trichotillomania report feeling alone in their experience of hair pulling. It may help to join a support group of people with trichotillomania so that you can meet others with similar experiences who relate to your feelings. Ask your doctor or mental health professional for recommendation on, or consider searching online for trichotillomania support groups. Preparing for your appointment. let's get into this one, because this is actually very important for people trying to get help. Seeking help is the first step in treating trichotillomania. At first, you may see your primary care doctor or a dermatologist. He or she may refer you to a mental health professional. What you can do. Before your appointment, make a list of all the symptoms you're experiencing. If they seem unrelated to hair pulling, trichotillomania can cause both physical and psychological symptoms. Note what triggers your hair pulling, how you've tried to deal with the problem, and factors that make it better or worse. Key personal information. Include any major stresses or recent life changes, and whether hair pulling runs in your family. I can say that right now, no. All medications, vitamins, herbs, or other supplements that you're taking, including the dosages and how long you've been taking them. Questions to ask your doctor to make most of your appointment time. Questions that you may ask your doctor include: what might have caused me to develop this disorder? How do you diagnose this condition? Is there something that will go away on its own? Is there anything I can do on my own to improve my symptoms? What treatments do you recommend? Sorry, dealing with speech stuff. If I decide to take medications, how long will it take for my symptoms to improve? What are the side effects of the medications you're recommending? How much improvement can I realistically expect if I follow your treatment plan? Do not hesitate to ask other questions during your appointment. What to expect from your doctor? Your doctor will likely ask you a number of questions. You're ready to answer them to reserve time to go over any points you wanted to focus on. Your doctor may ask, when did your hair pulling first start? I got no clue. Have you tried to stop pulling your hair? What was the result? Didn't work. I'm answering these questions because why not? Are there times or situations that are likely to trigger your hair pulling? Honestly, high stress, I guess. Or when I'm feeling dysphoric. What feelings do you have before and after? Before I feel stressed out and paranoid. After I feel a little bit better. From where on your body do you pull your hair? Eyebrows and arms. Do you bite, chew, or swallow hair? No. How is your hair pulling affecting your work, school, or social life? Well, this is kind of my work at this point, so a little bit embarrassed. Have you had treatment, medication, or therapy for hair pulling or other emotional issues? No. And that's pretty much all there is on this. Sorry for all the kind of mental health babble. But honestly, getting this out in the open makes me feel a little bit better. And right now, it's kind of a mild case for me. It's not like it doesn't mean I'm not worried about it, and I'm not embarrassed, but it is something that is to be taken pretty seriously. Like the fact that I just randomly started plucking hairs from myself. Like, that's not normal. And I know it isn't. And it's like I can't help it. Especially, like, when I'm, sitting on my bed like I'm doing now, and I'm watching a video, I'm just going like that. And I didn't pluck any right there. I was giving an example, but... And it's especially weird because, like, there's little, like, I have this whole area here that I do that with, and I even pulled hair from here. Right freaking here. I'm freaking myself out. This is new to me. Like, I don't know if I've ever dealt with this before. Maybe I did. Maybe I started doing this in high school and I don't remember it because I don't remember my high school years. Like, that whole thing was a fog. I got nothing. I'm ashamed of myself. I don't think I've ever felt this guilty about something I did to myself. I didn't even realize that me biting my lips constantly was also a part of it. Like, my God. I don't know how to feel. Aside from just wanting to apologize to everybody for, ranting so long and rambling and going on and on. But this is an important thing for us to talk about, because if it's happening to me, it could happen to pretty much anybody. And for all I know, I could have been doing this for years. I could be one of those rare cases where it happens later in life. I don't know. It's just one more thing to talk about in therapy, and that thought right there bothers me. Because I've already got so much going on. And this is one of the very few physical things that I do to myself that I don't even realize. I didn't even really think about, until now. I started realizing that, hey, this is getting weird. Why am I doing this so often? I'm sorry. I know I've been rambling a lot. And this is probably more info about me than you wanted, but if you have the same issue, if you have trichotillomania, get help, please, before it escalates, because this is not something to take lightly. It's not something you want to deal with on your own. This is not easy. I know you can feel ashamed, you can feel disappointed in yourself for even dealing with this, but it's okay. It really is. Like, you'll get through it if you get help. And just having a good support while you're dealing with this means so much. Anyway, I'm gonna leave this video here. It's gone on long enough. I don't want to drag this out any longer. Thank you so much for watching. I really appreciate you stopping by. I always do. If you like what we do here, like, comment, subscribe, all this good kind of stuff. It really helps us out a lot, especially when this algorithm is a mess. Remember, you're beautiful, you're valid, you're important. That is very, very, very important to me and what I'm here. And I will see you in the next video that I make. So until then, goodbye.